What is Botox? Botox is basically a toxin made from a Clostridium botulinum bacteria, and it is injected into the body. And what does it do? How does it work? Basically, it is injected into the body, and it is a toxin, and this toxin blocks the release in the neural pathway of acetylcholine, which is responsible for turning an electrical stimulation into a chemical stimulation, which is released into what's called the intersynaptic space, blah, 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 blah. And it blocks neuromuscular messaging, meaning when your brain wants to tell your body to do some kind of movement, it sends an electrical signal to the nerve ending, which releases a chemical, acetylcholine, and that acetylcholine goes to the postsynaptic receptor sites and stimulates muscular movement. That's all real interesting and sounds really complicated, but that's how people die. I mean, botulism toxin kills people. If it gets into the body and it becomes systemic, you can't breathe. Hello, you're dead. So it's very dangerous. And, throughout time, this has been the plague of mankind. It has killed people, right? If it's in the food supply and you get it into your body, you're in big trouble. But so we discussed sort of what it is, how it works, and why is it safe? It's safe because we now localize it to certain areas and we target the muscles that we want to paralyze. And by doing that, it becomes safe and it has some very important uses. Now, what are the uses? Well, the common one, I'm going to go get my Botox, and you hear people going for Botox, and it's like, see these lines? Like I'm going for my Botox on Wednesday. You get injections here, and these lines will go away. And so for cosmetic reasons, people get Botox. You can get it here and on your crow's feet, and cosmetically, it can make people look much better before and after Botox. So it has a cosmetic purpose. You go to a plastic surgeon, you get your Botox. It gets rid of cosmetically unpleasant wrinkles. What are some other uses? Well, I get it for migraines. So the frontalis muscle is considered to be involved in contractions, and there's a band of muscles here in the forehead, and that is believed to be a causative factor in migraines. And when these muscles are paralyzed, the frontalis muscle, your migraine subside. And in my case, it happens to work. I don't get it for cosmetic reasons, although it looks good. And I'll be getting it Wednesday, so maybe I'll do a follow-up video so you can see how my Botox turned out. What are some other uses for Botox? It can be used for excessive sweating. When you block the nerve stimuli to certain areas of the body, like under your arms or on your hands, it could block the stimulation that causes sweating. It also can be used for an overactive bladder. When the bladder tissue is constantly moving, surgeons can go in and inject it into the smooth muscle of the bladder, and that will cause a paralysis of the smooth muscle and prevent incontinence, going to the bathroom when you don't want to because of spasms in the muscle. And spasms anywhere in the body can result in problems for the individual, and Botox could be used. How does a psychiatrist get involved in Botox? Well, Botox given right here, these lines right here, in the literature it's called Virchow's triad, because you see this little triangle here? If you block that area of muscular movement, it treats depression. How does it work? The theories are that when you block the muscular movement here, the sensation or the stimulation of depression signals to the brain subside. And when these subside, it offers relief from depression because the body doesn't think it's depressed anymore. This is all hypothetical. I've looked at different things. I could never really figure out the exact reason that why Botox works for depression. It's still, University of Zurich is doing studies. There's some studies in the US. It's not clear. How is Botox done? individual doing it marks the area that they want to do the Botox with little marks. Some surgeons or some doctors just know exactly where to go. Some doctors mark it and they're exact. They put a little lidocaine where they want to do the injections. They pull back on a needle and take botulism out of the container, and they give it injections here. It takes about 20-30 minutes. It's kind of stressful. It's a little annoying. I go every 6 months. I guess it lasts 4 to 6 months. It takes 3 to 4 days to kick in, and after you get it, you're not supposed to bend over and keep your head up like this so it doesn't spread anywhere or something like that. You're out of that office in probably 30-40 minutes. It kicks in 3 to 4 days. For depression, you feel better within about 3 to 4 days. In terms of muscular contraction, at about the third day, you notice that your wrinkles may go away. Side effects from the procedure, I know firsthand. Bruising, it can cause a headache, swelling, flu-like symptoms. Sometimes when they screw up putting it in, you get an eyelid droop because you can't move your muscle for your eyelid. You can get cockeyed eyes, so it doesn't look even. You can get an awkward smile, dry eyes. If it goes systemic, this is just in the textbooks. I've never heard of it, never seen this, but muscle weakness throughout your body, visual problems, trouble speaking, trouble swallowing, bladder control, breathing problems. I've never seen it, never heard of it. It seems very safe, and this is something that is very well studied. So in conclusion, I talked about Botox and Botox use in the treatment of depression. Thank you, Dr. Mark Agresti.